All right. We're going to be live in a couple minutes here, everyone. And we're also live here.
We're live now.
Do I sit here?
Yes.
Okay.
You can pull that microphone as close as you want to your face. You don't have to pull it super close, but you can. We wanted it a minimum of about 4 inches away, though. Yeah. All right. And you're a doctor of
Chinese medicine. Yeah. I'm from Bend, Oregon. Can I put these on?
You can put them on if you want. If you feel more comfortable hearing yourself, you don't have to. But I keep them on to make sure everything's balanced.
I don't know which sounds better.
Whatever you feel comfortable with.
Okay.
Right before this ends, I'm going to put the mics on. You won't hear the music anymore, but that doesn't mean stop playing.
Oh, got it.
13 seconds. WWOZ 90.7 FM in New Orleans and online WWOZ.org. I'm Old Man River. This is Homespun Americana every Sunday from 2 to 4 p.m. bringing you the best in Americana music, current Americana music at that for the most part. All right, just finishing that setup with something came out back in 2022 from the Swampland String Band, and they will be performing at the Bayou Bluegrass Festival that we talked about at the beginning of this show. So if you like that stuff, that's a good reason to go. And they are playing the classic High on a Mountain, and it came off of an EP they came out with called Take a Whiff, came out back in 2022. Prior to that, we heard from 1100 Springs from a CD that came out in 2004. Heard the track Swerving off the CD Bandwagon. And prior to that, T. Marie and Bayou Juju off of their Sometimes Live album recorded at French Quarter Fest and the Saturn Bar. And it kind of came out last year, but it's really kind of coming out next year. Next time T. Marie's here, we'll explain all that to you. But we heard Aimant from that one there. And I want to thank T. Marie and remind you about Louisiana Cultures Campout.org. Check that stuff out, y'all. That's going to be a really, really cool weekend across the lake in a beautiful setting as well. Okay, I have one more guest today. I'm really excited about this one. Dr. Sarah Allen is here. She is a doctor of Chinese medicine, and it's I met her a couple of weeks ago. She has a podcast, YouTube channel as well. She'll tell you about that. And I gave her a tour of the station, and that is on there as well. But I invited her up here because Chinese medicine for a lot of people is kind of a topic that they don't know very much about. Alternative medicine in general. And we, in our society, I think we know about the other part of medicine, the drugs and the surgeries and all that stuff, because that's what we're kind of fed to believe is what we need. But not necessarily always the case, is it, Dr. Allen?
Definitely not.
Welcome.
Thank you.
So Chinese medicine entails a lot of different practices within it. Would you just kind of briefly give a synopsis?
Sure. I think a lot of people equate Chinese medicine with only acupuncture, but there's actually 5 pillars of Chinese medicine. And that's what drew me to the practice, because it encompasses so many things that can help the body heal holistically and naturally. And the pillars include Qigong, and that's really one of the primary foundations of acupuncture. Before they even started using needles, that's how they discovered the meridians, were through Qigong. And then there is nutrition and herbs and Tuina massage and then acupuncture. So I like to have all of those tools in my toolbox to help people when they come to me as a patient.
Now, how long have you been practicing Chinese medicine?
I was certified in Chinese medicine. I finished my master's and I got a doctorate after that. But I've been practicing for 10 years. I'm in my 10th year now. But then if you count my schooling, really about 14 years.
Mm-hmm. And for someone that's naive totally about this, how would they go, not to get in touch with you because you're far away from here, but a local listener, what type of research, where would they go to learn about Chinese medicine, acupuncture, and stuff like that, where they would feel comfortable?
You mean finding a practitioner or just learning about the medicine itself?
Both.
Okay. Well, the Web That Has No Weaver is a great text, a very basic text that I recommend for patients if they want to learn about the whole foundation of Chinese medicine. Also, if you find a practitioner that can treat you, they should be well versed in it. And I like to educate my patients as I work with them to inform them. And hopefully, if you find another Chinese medicine doctor, they will do that same for you, so you can be educated as you're being treated. Another reason why I invited you on is because I just recently reached the age of where I became eligible for Medicare, and I'm a Medicare recipient now. And this is the first time that I ever had insurance that covered acupuncture or chiropractic care, both chiropractic care, not Chinese medicine, but kind of similar in some senses to that. And I think there are a lot of people out there right now that probably have these policies. They may not have even looked at those chapters out of possible I want to say fear in a way, but I think it's just being naive and not being informed of what opportunities they could have with that. So let's talk a little bit about acupuncture and what you could help someone with that they may be trying to deal with the traditional doctor and medicines and stuff. Sure. I think a lot of people have come to me as a last resort. First of all, because of the fear of needles. And really the needles are like the width of a hair. And I think people are concerned about the number of needles. They think they're going to have 25 needles in their body. And they're not like a hypodermic needle. They're just a very small needle that is like the width of a hair. They're filiform stainless steel needles. They're disposable. We put them in a biohazard container. But the beauty of acupuncture is that it can treat so many conditions because you have these meridians or channels in your body which carry chi. And in loose terms, that means energy. And chi can move blood, it can relieve stagnation. So whatever ailment you have, whether it's internal or a physical ailment or even emotional or psychological, it can remove those blockages and bring energy to the area that needs to either be tonified or reduced. And so I can treat various conditions in one treatment, and not many other holistic or Western practitioners can say that. You can come in for a treatment, and let's say you have back pain, and then you have anxiety, and you can treat both.
And the way this works, and sometimes the relief begins instantly, and sometimes it can be take a little bit of time for it. Is that correct?
Definitely. I always tell patients to expect or to give it a try once a week or so for 4 to 6 treatments. And if there is no change after that, we might not see a difference. But I also tell the folks that every person is different and every condition is different. Sometimes I can have a person come in with an ache or a pain and it's gone after one treatment. Other times, especially with chronic conditions, it can take a lot longer. And then it sometimes is only becoming as a management tool for pain.
But for some people, that's a big step.
Right, huge step. I've treated children all the way up to people in advanced years. I treat a lot of veterans, and some people say it's the only thing that has given them relief, and that's very gratifying.
Well, speaking of relief, I wasn't sure if we're going to do this or not, but I have never experienced acupuncture before.
Right?
And I spoke with you a little while ago. Uh-huh. I've been having back issues, the worst I've ever had in my life. I've had a couple of incidents where back knotted up and stuff, and I ended up in a chiropractor, but it's been years since then. And this past week, Tuesday morning, I woke up, I could barely move, and it started serious pain going down my left leg. I went to the chiropractor on Thursday, and that helped dramatically. And I'm going back tomorrow again. I don't think I'd be here today if I didn't go there Thursday, honestly. But I asked you if you thought you could help me, and you said you thought you could.
Yeah, I treat back pain. It's the number one reason why people come into my clinic. So I'd be happy to let you.
So we're going to do a little acupuncture live here in the studio. Go ahead.
Okay.
Go ahead.
Okay.
Get ready.
And I do want to mention that chiropractic and acupuncture together, they complement one another. So, and as I said, Bob, you might feel immediate relief after the treatment. It could take the next day, or you might need subsequent treatments. But yeah, let's give it a go.
All right. I'm going to put a little bit of music on while we're getting this together and send this out to Elizabeth.
Is this on?
Yeah, I'll turn the mics live again once you're ready and everything.
Yeah, so I have my needles, and these are, I don't know if you want me to talk about them, but they're disposable. They come in a guide tube here.
Yeah, no, I don't think if we had more time, we would talk about that, but I don't think so.
All right. Do you want me to start?
Yeah.
Okay. Cool. So you said the left side, right?
Yep. So where do you want mine? Arm or neck?
I do a lot of local usually, so nice feel. Can you point to where you're hurting?
Right there.
Right there. Okay. And what about up here? Or is it really localized there? You said here?
Yeah.
On your sciatic nerve. It's kind of hard because I'd also put them in your leg, but
right.
I'm going to put one in your hand, and then I'm going to put a couple here.
Okay.
Is that okay?
Yeah.
Okay.
Now I won't be able to sit down with them back there, right?
You can.
No, I won't, though.
Are you nervous? All right.
Yeah. Was that one?
That's one. Did you feel it?
Yeah, just a little bit. Number two.
Number 2. Number 3. This does release endorphins, so it releases endorphins.
Mm-hmm.
So that's also really helpful when you're in pain. It releases anti-inflammatory chemicals.
One more. We're going live now.
Okay.
WWOZ 90.7 FM in New Orleans. Little John Hartford there, and send out to my friend Elizabeth Manieri, who's coming in and doing the next show here. Little jazz on vinyl, sitting in. And I know Elizabeth would never leave her records in the sun because she takes really good care of her records, but you should not leave records in the sun. And while that was playing, I just got my first acupuncture treatment from Dr. Sarah Allen. And she got me, I think, 4 times?
Yeah.
Yeah, and
4 times. I'm
not sure I feel any immediate relief because I'm standing up, which is like the worst position I've had since this thing's been going on. But
you can sit down.
I'm going to sit down now.
You can sit down
and see. But I also want to share something with the listeners while we're pondering this about your YouTube channel and tell them about that.
Oh yeah. So I have another interest. I mean, I have a very strong interest in health. I was an educator. I taught English as a second language for 15 years prior to that. And I love working with other cultures. I've done a lot of travel, lived overseas, and worked with students and families around the world for, those 15 years. And I originally started out as a journalist, and I love writing and I love storytelling. So now I've come to the point in my life where I'd like to combine all 3. And so I started, it's kind of on the whim, but I started a YouTube channel. It's called A Little Bit of Magic. And the premise is unexpected connections, healing, and inspiration around the world. And especially the way the world is right now, I wanted to do something to improve the world and make it a better place and to bring positivity and light. So I have a channel, and you can find me on YouTube. It's called At Magic with Dr. Sarah Allen. It's called A Little Bit of Magic. If you search for that, you'll find it. I've been doing interviews. I have some stories here in New Orleans. It's my favorite city. I just interviewed a Tibetan Buddhist monk a couple days ago, and I have some interviews with him. I have some on the problems of health. I have a Qigong video and more about the power of positivity and passion for longevity. But there's various stories on my channel. I also went down to Bentonia, Mississippi, and interviewed Jimmy Duck Holmes and did a lot with Bluefront Cafe. And I've been doing it about 5 months, and it's given me a lot of joy. It's been a lot of work.
And you did a tour of the station with me several weeks ago, and that just went up there.
Yeah, that just went up a few weeks ago, so you can see Old Man River, and I have a tour of WWOZ, and that was so enjoyable and such a dream, really, to be here.
I finally got around to watching it. And it's pretty
Did you
cool,
like it?
you know? Yeah, yes, I did.
Yes.
All right, so we got a couple of minutes left, Sarah. To someone out there that is just kind of pondering or something, what areas, pain, sinus issues, what other areas could this type of medicine be helpful to that they might not be seeing?
Right. I mean, probably the number one easiest thing because it's just so quick to treat is pain, and back pain, neck pain, a lot of tendonitis issues. It brings blood flow to areas, especially with tendonitis, for example, that doesn't get blood flow to those areas. It helps create a healing response. Digestive issues, hormonal issues, people with anxiety or depression, because it releases and increases serotonin levels, dopamine levels. It has a lot of physiological and chemical reactions within the body and brain. So that's what's wonderful about it. There's really not anything that can't be treated, but internal conditions do seem to take a lot longer, and chronic conditions also take a long time.
And for them to find someone that they might trust, or any tips or something for looking for a local practitioner that could help them?
Definitely. I would read the practitioner's bio and also look at reviews, but see what that practitioner has done for training, what certifications have, what specialties they may have, because people have areas of interest. And so if you want to see someone for pain, you wouldn't want to see a fertility specialist, for example. So really looking at the bios. Sometimes if you can find someone, word of mouth, if you have a friend or an acquaintance, family member that has found someone very helpful, that's what I would recommend.
Cool. Sarah, we got about 1 more minute left.
How are you feeling with the needles, Bob?
I'm feeling, actually, you mentioned, wait a minute, where did that come from? I am feeling, you mentioned the endorphins and stuff, and I'm certainly feeling that, and I feel a little less pain, actually, in that part of the back. The leg feels the same, but I've got...
If I had you on a table, I would treat your leg, so you'd have a more complete treatment, but that's a good sign that you're feeling some relief.
I can tell the listener out there that I certainly do approve of what I had. And I'm having this crazy amount, while we're talking, this technology is my kryptonite. And today, everything technological in this studio has not worked properly. And I feel like I've been defeated by kryptonite, but I think I got it. So then we can... when we wrap this up, things will work properly. Yes, thank you again for taking the time to do this. I wish we had a little bit more time to get into it a little bit more. But again, tell them about your YouTube, where they can find you on YouTube, and also your website, because you have a pretty impressive website.
Oh, thank you.
Practice as well.
Sure. You can find me. My website is www.Sarah Allen, SSARAH, Allen, ALLEN. .net. SarahAllen.net is my website. And if you want to find me on YouTube, look up a little bit of magic. And my handle is @magic with Dr. Sarah Allen.
There you go, y'all.
And please subscribe because I'm trying to build my subscribership. And watch Old Man River and WWOZ.
A great tour of the station. You're tuned to WWOZ 90.7 FM in New Orleans. I want to thank Sarah. I want to thank Mike and Michael for coming in today. I want to thank T. Marie for coming in. I want to thank you for listening. Elizabeth's coming up, and I'm unable to get her theme song on because the technology I thought was going to work for me just kind of fizzled away again. But you are tuned to WWOZ 90.7 FM in New Orleans. It is 4 p.m. and I'm going to put a little bit of jazz on until Miss Olivia gets in here with Sitting In. Check it out, y'all. Oh, man, I can't believe this thing. Everything today is gone. Every part of my technology. This thing just took a dump. I couldn't play your lead-in track. It's good luck with it. Every time I touch it, I did acupuncture on the air.
Wow.
It helped too. Yeah, so
To the 54-year-old menopausal best DJ
And a little bit of
Terry
magic.
Soros. 20 pounds of records to show.
come on in and make yourself at home, Elizabeth.
How's it going?
Good.
I liked your video. I saw it.
She was the one, yeah.
I
you
was
remember.
in there.
You did.
Hi, how are you?
Hi, how are you?
It's fine. That's a busy living.
Get that there. So I didn't get to play your track because you can see it's.
Yeah.
So I got
I tried pulling
Oh,
up
you
7
did?
Jordan, and that's where it all went. Haywire.
like one of these on
Yes, it does. I'm not leaning back on it, but it did help. It certainly did help. Don't know what absolutely triggered it.
Thanks for the opportunity, Bob. Old Man River.
Thank you. Thanks for everything.